change is due to concerns about supply chain and turnaround? I don't know. I'm not sure. So,
but Mayor Jacobs, to your question, I think it's too early to say. First of all, if that gets traction, and second of all, if it does, how it will impact testing volume.
Any other questions for me? All right, I'm going to go offline.
Have we lost audio?
There you are. I think we did for a second. Everybody there?
Yes.
Still here.
Okay. I think I'm finished, Dr. Gocher.
Did you go over benchmark 5?
Yes, sir, I did. That one's green. We've gone from, went back out, sorry. We've had 6 deaths, which is down from 11 that we reported during our last update, and are reporting that at green this week.
So this is very encouraging. We've made progress on 2 fronts, and we're all green on our benchmarks except for healthcare system capability, surge capabilities. This is all good news today. Any other questions for the benchmark presentation? Any other comments on benchmark presentation? If not, we'll go to the next item of the agenda, which is University of Tennessee Medical Center Knoxville data from Dr. Shemaya.
Great, thank you.
You're welcome.
So we just put that in, slideshow. So a similar set of circumstances with a few points to make. So if you go ahead and go to the next slide, please.
Have we lost audio again?
Can you guys hear me?
We can hear you.
Yes.
I can, yes.
That may be something on Dr. Gocher's end. I'm not sure. So as far as our hospitalization correlation, it continues to be very consistent with what we've looked at before, and it strongly correlates. So we've been in that 40 to 43 range of new hospitalizations for every 1,000 new cases. So nothing really new to report there. Next slide, please. So on this, if you notice on the left, we've not yet hit that 6,000 case mark. So the left, the Knox County, remember that's 113 days to get to the first 1,000, 15 days for the next 1,000, 9 for the next 1,000. And this is the exact same graph that I showed you, or the chart that I showed you last week. And then on the Knoxville district, that one is similar as well. I think we would like to start seeing that expand to longer periods of time as well, but similar to last week. Next slide, please. So this is similar information, and this is kind of about the acceleration and deceleration of our new cases. So you see there in Knox County, we had that peak with 889, and it has really dramatically dropped in that next week, and then has slowly dropped since that time. If you look on the right, we're still on pace to for August to be an equivalent number of new cases as was July. It's really just a matter of where we are at this moment. At this moment, we've definitely seemingly and consistently have slowed down. But the other thing to keep in mind is a lot of that big spike, if you think about when Memorial Day was, and then when July the 4th was, you can time things out pretty well based on the occurrence of those 2 days. Now, I'm not saying that's the end all be all, but it does correlate. And so not knowing with Labor Day coming up, what that might look like, I certainly think from 5 core actions, we're in a different place than we were on July 4th and Memorial Day. The district looks similar. I'll just make that general comment. Next slide, please. So this is not to belabor this point, but this was whether the foot was on the accelerator or not, and we saw that we peaked and started to slow down, and that has continued to be the case. And so this is, I see as certainly good news, and I expect, I can't say with absolute certainty, but might be the first thing, or this in cases to be together as something that will change if our overall circumstance changes. Next slide, please. So this compares us to the other counties, and you'll see that we have that downward trend. It looked similar to Davidson. Hamilton may be worth watching, just in that, if I understand correctly, they are ahead of us on some major events such as school opening and things of that nature. And you see that they've now had they had that very nice trend downward that we currently have, and they've started to trend upward. I think that Shelby and Davidson, I don't know all the particulars about those communities, but between the timing decisions they've made, they're really not in that same place that Hamilton is. Next slide, please. So this is new hospitalizations, and again, a pretty significant drop. And unlike the new cases, it would have seemed over on the right-hand side that total new hospitalizations in Knox County for August will be less than it was for July by the end of the month, the way it's tracking. The district shows similar, although again, the data in the district is generally not quite as convincingly positive as the data in Knox County. Next slide, please. Yeah, next slide. Thank you. So this is that was new hospitalizations. This is the day-to-day census across all of those district counties. And the point here is that we've seen that nice downward trend in overall hospital census, but it certainly isn't going down as quickly as it went up. And so that was part of the yellow, for example, that for our hospital status, just based on the current volume. The other thing you'll note, actually go ahead to the next slide and I'll make this point. So that's our projection, which is certainly for 2 weeks away, or for September 18th is favorable, but it's so sensitive to, if you look at the data, that the abrupt drop, there's that 134 and that jagged line down, and then it shoots right back up. If you took, there's probably some missing data in that one data point, and the prior days had been fairly smooth. And so if you simply didn't have that one dramatic drop, that 76 levels out more to around 100 or something like that. So just week to week, a little bit of missing data for this projection, it matters quite a bit. And then next slide, please. And then this, we said we weren't going to show all, several of the projections, but this just kind of tells you that our August 12th trend line, when it really peaked and was starting to sharply come down, was quite impressive. But then on August 19th, it was about 135. And I've said without that jagged data, today would probably be closer to 100 or so than 76. But it's still probably worth just looking at because early on, when we were really rising, we had 3 weeks in a row where we were projecting in a very similar manner. And of course, these numbers are much more favorable than the numbers we were looking at that time. And I believe this week, I will say also that, I've shown the mortality slide before. Since the last presentation, we've not had a mortality. And that's always just our medical center. Those are the ones that I have the ability to show. And so the dates were, but we've had a good week in that regard. So there's no more information to show there. And I believe that wraps it up.
We lost Dr.
Dr. Gocher.
I think we lost Dr. Gocher.
I think we lost him.
So does that mean Dr. Souza's sliding in?
I can until he either returns or doesn't. And just to recognize that Dr. O'Brien's here now, so he's managed to join us. Are there any comments on Dr. Shemaya's presentation? Questions?
Hello, this is Dr. Gocher. I'm on a phone. Did everything collapse with Zoom, or was it just me?
Unfortunately, it's just you, Dr. Gocher. Well, not that it's unfortunately, but I guess fortunately, it's just you. Yeah, so if you want to call, if you want to just hang on the phone, I don't mind sharing if that's easier.
Okay, that'll work for me. I'm sorry.
No worries.
It just faded out. It's time for a new computer.
Okay, yeah, I was just asking if there was any questions or comments on Dr. Shemaya's presentation.
I had none, but appreciate the good presentation. I had a chance to look at it before. It faded out while it was going on. So.
Great. So with no questions or comments, we can move on to other business. Dr. Shemaya, I know that you said that you had a few things that you wanted to discuss, as well as Mayor Jacobs. I don't know which one of you wants to. Well, I guess we need to add in the masks first. Okay. Yeah, I'm looking at the agenda on one screen and that's not on there. So I guess we'll add a sort of 7.5 onto our agenda, which would be discussion of the mask mandate. I'll open up for any discussion questions.
I know last week, this is Mayor Jacobs, last week we talked about this and discussed a little bit. I get a lot of requests in my office about what data points, what goal, what is the end date for the mask or the data for the mask mandate. I just think that this board needs to discuss that. Things are trending in the right direction. So there really needs to be some discussion about when that can end from your all's perspective.
Any comments?
Yeah, well, this is Dr. B. I'll chime in quickly. I think where we are as a community, based on what we've spoken about, UT starting back, Knox County schools starting back, I think we need to wait and see what, if any, impact those two events have on cases here locally. We can certainly look around the country, and I'm not familiar with it. This is the benchmark when you remove a mask mandate. But my staff and I, and we could probably reach out to some of our partners at the university to find out if there's some good data points out there to be able to decide when you remove a mask mandate. Certainly, I believe our community, the evidence is out there when you're out and about. Certainly people are wearing their masks and people are embracing the 5 core actions, and our numbers are coming down. So I think all of those things together are very encouraging. I would want us to wait and see what the impact of schools and UT are in our community. But obviously happy to hear any other discussion items. But we can also do some research on benchmarks for that.
Dr. Buchanan, one of the things that I think I had run into, and I'm sure that others have as well, is that strictly looking at positivity rate, which would be benchmark 1, that the 5% level was considered to be an inflection point that you could change, possibly something. And it might not be changing everything at once, but it might be changing something. But when we discussed solely positivity rate, I think as a board, we decided that the 5 benchmarks were more sensitive, but I don't know what inflections in those 5 benchmarks. I don't know where that would be. And of course, if everything were all green, I guess that would be an inflection point where you could change something or everything. We're almost there. But we probably need to get a little more information, not just what we expect is going to happen, but what constitutes enough of an improvement that you can roll back the restrictions. And do you have a feeling for how long it might take to get some information like that, or maybe what health systems throughout the state are doing, or how they're approaching it? I would look at that as at least a way to maybe quickly investigate this.
So if you look across the state, there aren't very many mask mandates across the state. Nashville has one, I believe Shelby has one. A couple of counties in East Tennessee have them. I don't know the other counties that have them besides those, and Hamilton. So I think we'd have to look around the country and maybe look at the CDC. I don't know how long it would take. I again would caution us against using just one thing to make a decision. Right. We know when we look at the data, we had we had holidays, Memorial Day, that's the one, July 4th. And it took a couple of weeks for us to see the impact of those events on our caseloads. What we don't want to do, and I hope people understand this, we don't want to lift the mask mandate and then go, oh, we we did it too soon, let's put it back in place. So yeah. we don't want to go back and forth like that. So I think just like putting things in place, we should be cautious and use whatever data is available to us to make those decisions.
I would be happy to investigate it, as I'm able, and just see if there are any metrics that are being used nationally to look at the same problem, because somebody somewhere is facing the same problem that we are.
I'd just like to add a couple things. One is the other factor that I don't want us to lose sight of is flu season. And although flu vaccination is going to be so important, I don't think we've really even know what the calculus is to add a flu season that is even semi-significant to COVID-19. And then you add the other factors with schools and all that. The other thing, and this is really more of just a point of general discussion, or at least feedback that I've heard from those in the community, is that one thing, certainly there's discussion about masks, but the other thing is the need for people to just have consistency. And that's if you're running a business, if you're planning for your childcare related to school and those types of things. And I made the point in the last meeting when Dr. Hurt asked me, what we've seen happen was fast enough that I don't see another reason why we would have had this favorable trend if it were not for the reliance on the 5 core actions. And so I don't personally see anything to suggest that if we backed away, and again, it's all of those actions, then it's going to be kind of this perpetual yo-yo chasing our tail situation. And that's disruptive. As much as all of this is disruptive, that is fundamentally disruptive. And so I wanted, to your point, Dr. Buchanan, of doing it and then say, whoop, that was not the time to do that. That whole process of uncertainty creates a lot of issues. And again, if it just happened, so the timing was perfect in the way it all played out the first time for it to make scientific sense that there was a cause-effect relationship there. I have no reason to think that the exact same thing wouldn't play out again.
Well, Dr. Shamiya, in epidemiology, you do have Farr's law, which says that pandemics follow a bell curve. So nature could be playing a part in this as well. And I think we shouldn't forget that. And I certainly understand your point, but nevertheless, I don't think that we can point to one thing and necessarily say, this is the cause and this is the effect, because if we look around the world, a lot of different countries have taken different approaches towards this with different outcomes in many places. So it's hard to just say, when we do this, this is what happens.
It's a fair point.
I would like to say that is true. We can't prove an absolute correlation. But if we look around our nation, when we see cities and counties make the decision to lessen restrictions, and we understand people are COVID fatigued, it wears on our psyche. It does affect all of our mental health, our well-being, our economic stability. But when we've seen this nationally and internationally, when restrictions are lifted earlier, people get sicker, and that overwhelms the healthcare system. And so then those cities that have made those decisions have to, backtrack, and that does create even more disruption. And it doesn't really help the overall health of the community. So we don't have absolute correlation, but we can observe what's going on. And I agree, we still have a couple of big variables that are going to take. It's going to take a couple of weeks for us to see the impact of school opening, of UT opening, of football season beginning, etc. So I would also caution us to be watchful and waitive, and be glad. I mean, I think we're all very pleased that the numbers are going down. That's what we want. We want to keep that way. And we understand people being very frustrated and very tired, but right now we've got to hold the line. We as a community have to hold the line and wait and see how these other variables that they may or may not impact the disease burden and the impact on our healthcare system. But we have to wait. I think that's the prudent thing to do, is wait.
Any other comments, questions?
The only other thing I would say is that our complaints have gone down quite a bit regarding masks or anything else at this point. So I know there's still people who, we're getting those comments and emails and requests to change things, but complaints into our system have gone down.
Any other comments from anyone? All right, then why don't we move on to other business? Dr. Shamiya.
Yeah, I can get us started. And this is really, the intent of this is, at least from my standpoint, is just to be a conversation. And what I'm specifically referring to is just thinking about the college campus, University of Tennessee, and how the issues they're dealing with on campus interact with the overall situation for the county that we're looking at. And so I really have thought about this over the last few days, and I've framed it in a way that I wanted to kind of discuss with you guys, and just to see, what you think, essentially. And so I'll just, if you humor me for a few minutes, and I'll kind of get through this. So I think the first point that I'd make is that we know that any sort of communal living is just inherently challenging in the midst of COVID-19. And so whether that, for a college campus, there's dorms, there's fraternities, sororities, off-campus houses, things like that. It's challenging. It's not impossible, but what we've seen in just watching other colleges is that very quickly and somewhat dramatically at times, they've spiked in cases. And those are colleges that are ahead of UT Knoxville. And, in the news, that's often been linked to super spreader events such as off-campus parties or fraternity or sorority functions. And so, what I think the lesson there is that, at least anecdotally, is that when you're dealing with a communal living situation, you don't get a lot of do-overs necessarily. You got to really try to get it right as much as possible. And that's left that, there's only so many things that a university can do in that regard. And so what I sense is that UT has I feel like an exceptional reopening plan, and I've looked into it, but clearly they're not going to be immune to this, the effects of the collision of a super spreader event and a communal population. They're going to be affected to some extent with that. And I also want to applaud them for how transparent they've been with their data. Because I think that has been a real service, to the community to see, it's very easy to tell what's going on there. And so the other thing I've concluded as I've thought through this, and just to be clear, guys, I'm not heading toward an answer. I'm heading to a discussion, but it really seems like the UT campus cases may not track with the rest of the community. I'm not sure yet. But in other words, Knox County could be improving and the campus could be experiencing worsening numbers. And I think there's several reasons why this could happen. One is simply that there's just not, even though that local geographic area is spiking, it's just not enough. The overall Knox County is too big for it to really have an impact. The second thing is, Dr. Buchanan, I believe there's a lag if they're living here, but they live somewhere else, for those cases to get actually attributed to Knox County. And then if I understand it, somewhat depends on where they isolate. If they go back home to another county, those may not get attributed to us at all. And then finally, it's the simple possibility that they are spiking more than the rest of the county. But it creates a data challenge, I think. And so the other thing I thought about is that, I think Knoxville, Knox County sometimes gets classified as a college town, but it's really, I've been to some true college towns, and there's where the campus, a large campus, basically is the single impactful thing in the town, and that's not the way this town is. There's a lot of things going on, so we're in a position in which what's best for the campus might not necessarily be best for the rest of the community. And I think at the end of the day, this has implications beyond just the students. And what I mean by that is that there's a lot of businesses that really depend on those college patrons to thrive, to run their businesses. And if something were to happen, I mean, I'll just, Chancellor Plowman, Dr. Plowman, when she wrote the board a little ways back in reference, I think that was in reference to bars, but I'll quote her, is that preserving our ability to have students live and learn in Knoxville by maintaining a healthy community environment is also an important economic consideration. And so, it would really not be a good thing on so many levels if all those students had to be sent home. And I by no means think that's imminent, but we've watched in the news where it's happened in other colleges. And so ultimately, I think the success of our campus is not just a public health issue, which is our lane and it's where we need to be, but it's also an economic issue. And ultimately, we feel that those 5 core actions are, we believe in those, and I know we've kind of batted that around and we continue to do so, but common sense dictates that there are some situations where it's just very hard to pull off the 5 core actions. So the key to some of this is to try to avoid those situations as an individual. And I truly think that it's going to take the cooperation of the campus community and local businesses to be able to pull this off together, because they're really in it together. And so from my standpoint, this is a tough one because we said we're going to make data-driven decisions, and we've talked about our Knox County data that is in a favorable way or moving in a favorable direction. One thing I thought of is, I don't know if there'd be a role for Dr. Plowman in whatever mechanism she wanted to formally just let us know what does she need, what would help her. But I wanted to open that up for the group to just think about and talk about a little bit. And I know I've been long-winded, but I'll be happy to take questions or just open it up for discussion.
Dr. Buchanan, Mayor Buchanan and I are briefed on, say, UT's reopening plan and some of the things that they're doing. I'm sure you guys have also been working with them. Have you not? Would you like to, what's the depth of that relationship? What have they reached out to you guys for, and all that sort of stuff?
So Charity can elaborate on this better than I. We speak with and work with the university on a daily basis. So one of the things, knowing what we're doing, and Charity can elaborate, I wasn't quite sure what the question was for us to discuss, but they have hired their own contact tracers. We trained their lead contact tracers and are in communication with them at least daily, if not more often, about what's going on campus. As far as reporting to us, we are getting those reports from them in a timely fashion. The students that get tested in Knox County, if they get tested when they get tested, that's going to go to the state and back to us, or sometimes directly to us. A lot of times the university finds out about a case before we do, and they notify us with that information. Charity, do you want to kind of elaborate on the relationship and how that's working?
Yeah, like you said, we are in touch multiple times a day with the folks on campus, all the way up to Dr. Greg, who's running the response. I usually talk to him pretty much daily as well. And just what you said is true. So we're doing just similar to with the Knox County schools, we do our initial investigation for all of the cases and then refer to them to help and assist with the on-campus tracing piece. A lot of times they've already done it. So if somebody's not even feeling well, they get routed into their system. So they don't even have to be a positive case to start in contact tracing on campus. And somebody from there might want to come and present their full plan to us or to you all at some point. But that is something that happens, which is one of the ways that we learn about things early, typically with them. Dr. Buchanan is right. Dr. Shmia, your points on lab reporting and jurisdictions are valid. The only one that is a little bit different, if they're getting tested on campus, we're getting those directly to us. There's not a delay there, definitely. So if they get tested somewhere off campus, there could be, if they put their home address, a jurisdictional delay that happens, but that should make it back to us relatively quickly if they're living on campus. We have a lot of interactions with the East region because we also have a lot of students that commute in. And they're also communicating with us and letting us know when they identify students, and we're pushing that to the university as well. So if you live in Blount County and you test positive and they've done your investigation, we're getting notified and making sure that the university knows of those as well. So I think while there can be a little bit of a lag, I think overall we're getting a pretty good picture of what's happening on campus with Knox County residents. I will say it is challenging to see the full picture. So I too am very happy with seeing their dashboard and being able to see the full picture of what is happening on campus with other regional cases that could be impacting them.
Thank you. And so that's helpful. I do think that those are pieces of that very well thought out response that they have in place. Let me frame this. I kind of gave my general thoughts. Let me frame this a little bit differently. So just to get us talking about something specific, again, not with the intent of necessarily any action, but a couple specifics. A gathering size that works for the community may not work on a college campus. Or I have gotten some anecdotal reports of that the, after 10 o'clock, a place that sells both food and alcohol that is allowed to stay open based on what the constraints that we've placed. So they're doing all right. They're doing what they're supposed to do, but they're becoming more of a place where they're functioning more like a bar after 10 p.m. to that particular group of that campus community, if you will. And so I'm torn because, again, it's almost like we have two, within the county, we have two different populations of things that we would potentially need to address. And I'm not exactly sure of the right way to approach it. That's why I guess if there was anything that I proposed, it was to ask Dr. Plowman if you guys thought it would be meaningful, helpful, and if not, that's okay. But for her to specifically tell us, if there's nothing she needs, great. But if there's anything we could do to potentially help her, and it's within our ability to do, because again, we've got a whole Knox County to think about. It's not just that we're here to address the campus. Then I think I would feel helpful if she could tell us if there's anything that she needs. That's one action that we could take, is just ask for that.
Kind of bring up here the UT letter that we did receive from some of the faculty, so that everybody knows we did receive requests to at least look at things. And I guess my question back to Mr. Sanders, and I think this is true, we don't really have control specifically of the University of Tennessee. It's state education, it's a state facility. So we can, on the outskirts, I think, make an impact, but on the campus itself, and in regards to some of the specifics that UT faculty, staff, and students may wish, we may not be the source of decisions for them, or we can always recommend, we can work in concert, but I don't think we can be the deciders of UT specific actions. Is that right, Mr. Sanders?
Dr. O'Brien, I concur in that. Since I haven't seen the letter, I don't know exactly what this faculty and staff and such are asking you to do, but certainly there are areas of UT campus life which this board may not be able to control. Typically, for instance, when you write your regulations, you exempt state-owned property. Well, UT is a state-owned facility. So some county ordinances may apply there, some may not. So I'd have to look at on a case-by-case basis. But I think what your overall proposition is correct.
Yeah, I want to get that out there because that question has been raised. It was on the local news I heard about earlier today, saying that we would be bringing something up about this concern from the members of the campus community. But we don't have direct control of that. Again, we do want to work hand in hand with the university, try to do what we can to implement positive change around the university, but we can't do the university itself as best I can tell.
Additional comments? Oh, sorry, go ahead.
No, so I mean, I guess, Dr. O'Brien, the only thing I would mention in response to that is I think there is a difference between a resolution or a binding ordinance or whatever and a recommendation, and so I definitely think that, it is in our lane to, based on the expertise on this board, to potentially make a recommendation, to debate a recommendation, as to, and Mr. Sanders, you can correct me, but, as to whether it gets followed on an area that's not in the jurisdiction of this board, then clearly we don't have the ability to make that happen. But there still may be value in recommendations.
Yeah, and just I guess to state from actually being on campus over the last few weeks, the university's taken phenomenal steps to really do everything that they can on campus. I think certainly the concern is any of the off-campus areas that they don't have jurisdiction over, and they can't really police those larger gatherings that sometimes happen. And so I think that just looking at the university, it has done everything it really can in terms of its property. And the question is there something that this board can do that's outside of that? And I think that's challenging. So going back to what you mentioned about the restaurants becoming essentially bars after 10, gatherings that get really large, how do you deal with that without impacting the entire county, which we don't want to do since we are having a good trend right now. And so that's certainly something that I've asked Mr. Sanders about. Is there a way to do something that's more surgical that we can actually, basically focus on those areas that are really being impacted? And I think that he's looking into that because I just asked him not even 24 hours ago. So he's trying to figure out if there is something that can be done that's a little more surgical, but I think that that's kind of how we could probably best help.
That's right, Dr. Sousa. I've not finished by looking into what you asked me about yesterday. Now, having said that, several of you are aware that I've been working on a proposed revision to the curfew regulation, which you passed in response to people's wanting it to encompass more than just institutions that sold alcoholic beverages. And I understand may be proposed next week by one of you all. If you want, we could take another look at that and make sure it encompasses a situation that you're discussing now. I don't know whether it can or not, but I could certainly take a look at that and see whether we can encompass the situation where these entities that don't sell alcohol become big hangout spots. I don't know whether we'll be able to do that or not within the confines of that curfew regulation, but I can certainly look at it if you would like.
I think, okay, so I'm going to ask for some clarification because it sounded like we were looking at restaurants that do serve alcohol becoming not hotspots, like not COVID hotspots, but hotspots after 10 because the bars are closing down. So everybody's moving to the restaurant to finish their evening. And then we also last week had a discussion about gentlemen's clubs that don't serve alcohol, they're BYOB. So are we mixing those two together, or am I just confused?
Right. Dr. Buchanan, you were right that what was specifically asked of me last week was the gentlemen's clubs, but I certainly took that to mean other entities as well that allowed what we'll call for shorthand term brown bagging, that bringing alcoholic beverages onto the property for customers or patrons' consumption. That was what the proposed regulation, which has just begun to be circulated now, it has in mind to try to address. Now, it's true the way your regulation's written now, restaurants are completely exempted from it. Restaurants defined under the regulation as being deriving 50% or more of their gross revenue from the sale of food. I did not pick up on the distinction in your earlier discussion, and I apologize that I didn't. What was being discussed were people going to entities that were in fact restaurants and gathering there. That is different under your regulation. Your regulation does not address that situation as long as alcohol is not being carried in or sold at that time. Now, what you all want to do about that, you'll have to tell me. It's certainly not for me to propose policy. If you all want to address that, ask me to, and I'll see what I can come up with.
I'd like to say that I've asked for the past two meetings I proposed a friendly amendment to that to recognize that the way we describe, basically to make it so that any alcohol, sit down alcohol after 10, regardless of the establishment, be a curfew on all businesses that do that, because citizens continue to point out what they believe is a discrepancy and an inequality, and it doesn't really solve our problem, which is we're trying to minimize people spending a lot of time in close quarters without observing the 5 core actions. So I've brought that up in the past. We haven't really discussed it, but here we are. Here's an opportunity to revisit it with Mr. Sanders' counsel.
Well, again, Dr. Hurd, I would say that, whatever the will of this board is, I will do my best to assist you. It's not my place to suggest policy to you. So if this board wishes for me to try to draft something along the lines of what you suggest, I'm glad to, but one of you all will have to ask me first, and then one of you all will have to propose it at a publicly noticed meeting to vote on it and discuss it.
Just to be clear, I wasn't in any way suggesting that we were telling you right now to do this, but I was just reopening it up, I guess, to the floor for us as a group to decide or discuss. Thank you.
One question to Mr. Sanders. Do you have an impression that we may have the ability to do geographically localized restrictions versus open to the entire county?
That is one of the things I'm looking at right now. I'd be lying if I said I had a good answer for you now. I will say that I've said in private discussions before that the narrower you get in your definitions, the more problematic it is. The easiest thing to do is to say this board has jurisdiction over the county and here are the rules for the county. You start saying on Elm Street but not on Oak Street, you're going to have an issue, I think.
Well, and I guess that gets back to one of the points I made is I wouldn't want us to do something unless we had the impression that it's going to help. And so, I can't sit here and say that I know what is or is not going to make a difference with the UT campus community navigating this all the way to Thanksgiving. But I'd like to know what those things are from somebody on it doesn't matter who it is, but somebody who in the know from campus who could tell us.
Dr. Shemaya, and Dr. Buchanan may have already gone over this when I was dropping in and out, but I got a call from Dr. Plowman a couple of days ago, and she was wondering what the possibilities would be if the board could lower the numbers on group gatherings to 25. And I told her that for a variety of reasons, I didn't think that was going to be possible. One is that it probably wouldn't work in the community, but number two, our numbers have been trending in a way that would not lead us to make more stringent requirements rather than less stringent requirements. And I did take the time to really commend her on what she's done, because she's sort of taken a very surgical approach by looking at the students, whether they are campus affiliated meetings or not campus affiliated, whether they're on campus or not, and coming down harder than we could come down on somebody. But that's what she asked for, what she thought maybe might be possible. But I told her I didn't think that was possible.
And we certainly can, if it's the will of the board, we can certainly officially send Chancellor Plowman a letter asking for any recommendations that she thinks would be helpful for the university to reduce the risk of cases. In addition to that, if you'd like to hear more about what they're doing on campus, we certainly can have somebody come and give the Reader's Digest version of all that they're doing, because they're doing a lot. They're doing surveillance, they're doing a lot of different things. And honestly, they're kind of going above and beyond. Like Charity said, if somebody's symptomatic, they go into monitoring immediately, and they make sure they get them tested, and they make sure do their best to keep them from coming to campus. So they're really doing a lot. So we could certainly, we being the health department, could certainly ask Dr. Gregg to come and speak briefly to the Board of Health next week if he's available, and if the board would wish, and if the board would like to send a letter to Dr. Plowman just requesting any information and what she thinks might be helpful that we could do, we can do that too. Just need to know what the board would like to do.
What are your all's thoughts about, and this just came to me, I mean, someone, either Chancellor Plowman, someone from that team, while we're waiting to see how things unfold, and let's hope they unfold nicely in that cases stay down, illness stays down, etc. But what about asking someone from that team to perhaps regularly provide just a 5-minute presentation, just as Dr. Shemaya does, just as you do, Dr. Buchanan, because this is a really significant, could be a potentially significant variable in the data, in how things play out. So, and she has done a phenomenal job as a leader in being transparent and going above and beyond, getting a team together. Really, to me, she strikes this great balance of great information, but also motivating the students to do the right thing. So with school opening, we've already identified clusters. The numbers are not getting better on campus yet. And we expected that. We knew that when school opened, we would, students would get sick. I think it would benefit us all, since since UT is really a key player in how the data can be impacted. Why not? I can't think of a good reason why we wouldn't want someone, a representative from UT, to come fill us in just 5-minute update. I'm just throwing it out there. I literally just thought of that. What are your all's thoughts?
I think there's merit.
I think it's a good idea.
Yeah. I think there's merit in that.
I like that idea.
I do too.
Any objections to asking someone from Chancellor Plowman's, either she or someone from her team, to try and give us a quick update at each meeting on how UT is doing?
I think we can invite them. They may or may not be available, but at least have an invitation out there for that.
Okay. Dr. Buchanan, I'm not sure how best to handle that if that comes from your office.
That would really should come from Dr. Gocher as the chair. We can help pen the letter, but it should come from Dr. Gocher since he's the chair. What frequency would you think is appropriate?
I would think probably weekly for right now, because this is a fast moving target, I think. And it wouldn't have to be a long presentation, just an update, I would think.
Okay.
So we could write a letter to Dr. Plowman. Probably her chief of staff or her chief medical officer, Dr. Gregg, might be somebody that would be a good point person for it. And Dr. Buchanan, Dr. Gregg, and maybe I will pen a letter maybe to him or maybe to the chief of staff or to Dr. Plowman, just requesting that they give us some information on that. We'll figure out how to craft that, but I think that's a really good idea.
Okay.
And then, Dr. Buchanan, to your point, at least this first time, if there is anything in particular where they see a gap, I mean, I've been so impressed at their response to what is in their sphere of what they can influence, including taking swift action when things are not followed. And so I'm more concerned about the things that they don't have control over as much as I am about the things, because best I can tell, they're really handling things well with what they can do. And so at least this first time, what do they need?
Any further discussion on this topic?
Dr. Seuss, I was probably out for a portion of this. Was this in response to the letter from the University of Tennessee faculty, or just a comment in general? Did we address the letter specifically?
Yes, Dr. O'Brien mentioned that, and how this kind of rolled in with that discussion, as well as Dr. Schmidt just mentioned the many efforts that are being done by UT, and what's our ability to actually help with their response. So any other, questions, comments regarding UT specifically? Other topics in our general discussion?
Dr. Buchanan, did you have an opportunity to go over anything about our oversight committee meeting today with the board?
I have not. I'm happy for you to provide that report back.
Okay. So Dr. Buchanan and I met actually very nicely as a first order of business with the joint Senate House Government Operations Committee in Nashville today, which is why we're distant calling in here. And Representative Daniel is the chairman of that, who is the representative from West Knoxville, and he was very cordial and basically wanted to know two main points, I think. First of all is what was our perception as to the makeup of the committee and how the committee was officially formed. In other words, appointed, selected by our professional groups, then basically appointed by the, sorry about that, but basically appointed by the county commission. And we went through in detail what each one of us's qualifications were. And then a discussion about sort of where our authority was derived from. And of course, you all are in receipt of the Tennessee Code annotated legislation on this, and we just referred that back to him. And he really had no other real long points of discussion. It took all of about 15, 20 minutes maybe. And I think my perception was it was well received. There was really no comment from any of the other members of the committee.
Well, thank you both for driving to Nashville and back on our behalf today.
You're
Yes,
welcome.
thank you very much.
Yes, thank you.
Jack hasn't made it back yet.
I was going to say, thank you, Dr. Goetzer. It looks like you got the good end of the bargain there with where you're at.
We're gonna have dinner with my daughter and family over here, grandkids. So it was a plus. So, but we appreciate the opportunity to sort of at least put everything solidly in place as to how we came to be and what our responsibilities were. And I had a informal discussion with Representative Daniel and told him that, this was something that was kind of, in a way, the law was always there, and the legislature had long ago given us the responsibility to do what we do. But, like many things having to do with this pandemic, never in any stretch of the imagination do we think that we would be where we are today. And there's really, three branches or two branches of government that could control this. One would be the governor, the executive branch, and he has delegated that responsibility to us. And the other would be the legislature, and they last amended that TCA legislation in 2002, I want to say. And it's certainly possible if there's a move from the House of Representatives or the Senate to change things, they could certainly do that. But how we got where we were, nobody could have ever imagined. But we have to work within our responsibilities and do what we need to do.
All right, thanks for that update. One other thing that I think that we may need to bring attention to is that currently, I think the ability to do virtual meetings may expire at the end of maybe this week it is. And I don't know if you've heard any updates on that, Mr. Sanders, if that's changed yet.
I have not heard an update yet. Reliable sources tell me that it's most likely a new executive order will be coming out. That's certainly our bet, and it'll probably extend the electronic meetings format, but I completely concur that you all need to be ready to have an in-person meeting next week. I mean, it's easy to continue with Zoom if that's what happens, but it's not going to be so easy to find a place to do it, make sure it's available, and get everybody there in case you have to. So I'd go ahead and get somebody on that now.
We're on it.
Good.
I'm not.
Also,
correct myself. I have nothing to do with it, but my staff is on it.
Excellent. The other thing I will mention along with your meeting next week is you'll remember that you probably need to, you need to start doing public forum every week. And I had a discussion with the mayor earlier to see whether his staff would be able to assist with that in the same manner they did in August. I'll let him answer whether or not they're able to do it or not. If they're not, the county commission had a tool to have public forum on Zoom as long as you're on Zoom, but somebody will again have to coordinate all that.
That was my question, Mr. Sanders, was how is county commission, now that they've been forced not to meet in person due to illness on their team, how are they managing the public forum? So you're saying just by mere virtue of being on Zoom, then there's a certain amount of time set aside. I'm just trying to envision how that would work.
Well, what happened at the last county commission meeting, they had a public forum and somebody from the IT department monitored the waiting room, the Zoom waiting room where all these people were in, and would let them in, let them have their time to speak, and then I guess move them on out of the meeting. Okay. I will leave it up to the experts in tech to explain how that's done, but if they can do it for county commission, I'm confident they can do it for you all. Or you can go to the same format that you had last month where everybody meets physically and is simply broadcast to you. That was a very clean way to do it also. Of course, if you're meeting in person, then they'd just simply be wherever you are.
We could probably do either way. I'm sure my IT people will be texting me here in a minute to say that they can do the Zoom way. But we can do either way. It's a little, how we did the first one was pretty labor intensive. We had a lot of people going through that, but I think I think it was well done, and I think just people getting the opportunity to speak on camera or in person is better than just with commission. David, I believe that they just call in. I don't think that they're actually on a video from what I saw. But I might be wrong about that.
Yeah, actually, they were on video.
Were they? Okay.
And maybe the early ones weren't, but that may be just because the video was turned off. But the later ones were actually on video.
Thanks for the correction. We could do either way. And then I can talk with our people to determine what the best way is, if everybody is agreeable to that, either Zoom while we're doing Zoom, or we could also do it like we did last time, having people come in.
Mayor, we did not get a lot of email that I recall that spoke to whether the public was receptive to that, whether they like that. Did you get any feedback about whether that was a positive move to do that? I sense it is, but I just don't know if you received anything.
Yes, it was positive. The reason that this board had discussed potentially, not doing it week to week was really because of the labor intensive way that we did it. But overall, I think the public really did appreciate that. And again, I have to say this, my staff did a great job. Our team did a great job. So that came off really well. But I think that anytime you can give the public the opportunity to comment is a good thing. And they do appreciate that.
Yeah, I would agree that, we read emails, we've got emails, people can make comments when they're watching us live time. We get mail to our personal homes, phone calls, etc. And I think it's good for the public to know we really are very thoughtful and deliberate, and we are listening and watching and reading our emails. And I think an opportunity for the public to show up in person, so to speak, that is another reassurance to our fellow citizens that we're doing our best.
One thing I want to ask, you just mentioned something. Is this something where we are now required each meeting, each week to have a public forum versus our plan of once a month, so we could stay on task and have our meetings, 3 of them where we're dealing with data, and then 1 where we let the public make comments? So has something changed that I missed?
Nothing changed, but we weren't doing it right before is essentially the answer. You all chose not to have your own rules of operation, but rather to adopt county commission's rules, as I understand it, or by lack of having your own rules, you have county commission's rules.
I don't
county commission's rules.
Choice.
I'm sorry?
I'm saying, I if that was a choice or decision the board made, I don't recall it.
Yeah. I think it was more that we don't have any rules, so we fall under county commission, because I don't think this body ever voted on any rules that I can recall.
Anyway, you don't have rules now, and in absence of rules, you follow county commission's rules, and county commission's rules say public forum every meeting. Well, so if you want to have your own rules, I can help you develop them, but you don't have them right now.
Well, isn't it a rule, or we said we would do it once a month? Would that not be, quote, our rule to follow so that we could stay on task? Unlike a county commissioner, city council, we being a public health board are different. We are not elected officials. We are not operating under that way of operating. And we try to be more scientific and look at the data. We do listen to what the public says as information, but it is not the primary information in our regard. We're not like a county commissioner dealing with a district, getting input from their people to make a decision. We instead are supposed to be, as a group, looking at data, looking at information as the evidence comes to us and making the best decision. So I would like us to try to stay on task, and let's offer this, but try to do it once a month for 30 minutes. And the rest of the time, let's stay on task looking at our data, at our benchmarks, and trying to do the best job we can for our citizens.
Dr. O'Brien, I sympathize. I understand. Unfortunately, you all are also performing a governmental function, and you are at this time subject to the county commission rule, which is public forum every time. Again, if you all want to vote to have your own procedural rules, I'll be glad to assist you to do that. And no public entity is per se required to have public forum. But, and so long as you're operating under county commission's rules, I think the answer is you have it every meeting.
David, for clarification, would we have to like write and adopt an entire set of rules, or could we fall under county commission for everything but public forum once a month? Do you understand what I'm saying?
I do, and I'm trying to craft in my mind how to do that. I would think even if you did that, what you would do is write a set of rules that said we follow county commission except for where we deviate, and here's how we deviate. So either way, you're going to adopt a set of rules. I don't think you have to craft it from whole stone if you don't want to. I mean, every lawyer cheats on that. I mean, we always pull up an old document and start working from it. So you can feel free to keep what you want, throw out what you want, but you know, you're going to have to pass something and adopt it.
So to Mayor Jacobs, if we decided to have public forums at each meeting, and we may be meeting weekly, or we may be meeting every other week or every month at some point, this may change. What are the logistics of that? What's the cost of it? You mentioned your IT people would be stressed a little bit. Can you give us specifics on that? That may help us make a decision.
Sorry, Dr. Yates. There's not necessarily, the cost. It is just we're dedicating, like, my office as well as IT has people that are working on this. So, they either get into overtime or they can't do other things. That's just the real issue is, you're taking away their ability to work on some other projects or to do whatever.
Realistically, is this
that makes sense?
Yes. Realistically, is this a strain on things? I mean, your answer sounds like it would tax the system some.
Potentially. Realistically, I think going forward that we would see a decline in the number of folks coming to public forum, except if there's, say, some sort of hot button issue. That's generally what happens in these things. But nevertheless, we have to have PBA security here to do all the screening. If we do it in person, Zoom is much easier to do because then people just call in and IT handles that. I'm sorry, Dr. B, did you have something?
I was going to say, my staff can work with IT to work out the details, because people could call in and or come in through Zoom. They could do it either way. They didn't even have to have internet to be able to call in, is my understanding, or don't even have to have internet to be able to call in. So, my staff is happy to work with IT to streamline that so it's not a big heavy lift for everybody every week. Because the way you did it, Mayor, worked great, but it was, your staff did a lot of work, and we all have other stuff we need to do. And the more we can take advantage of, technology and other ways to do things right now, I think that would help. So if you're okay with that, if the board's okay with that, my staff can work with IT. And right now, if we're going to have to fall under commission's rules, then yeah, they have public forum every time. If we decide to write rules, I would caution us as a board to not write rules based on a pandemic and based on meeting every week. Because there's at some point we've even talked about reducing these meetings. At some point, I know we'll reduce these meetings. So let's not write rules based on a pandemic and a very unique situation. So that's just something for us to keep in mind. But Mayor, if you're okay with that, I'll get my staff to get with IT and we'll sort it out.
Yeah, if the rest of the board is amenable to electronic public forum, I'm absolutely fine with that.
Well, one person's opinion, I would be strongly in favor of it because I think it serves transparency and it gives people an outlet to discuss things outside of emails. So I would be in favor of it.
I would like to seek some clarification because it seems like we're talking about a couple of different things. So I just want to make sure I understand. We're talking about public forum. That's how this started, and we all seem to be in favor of it. Frequency, that's up for discussion, and logistics a little bit. But then we kind of segued into talking about adopting commission rules because we've never had a formalized set of rules. It's been a default kind of system. So are we also talking about that? Do I need to make a proposal that we discuss it and then ask to, yes, we adopt the commission's rules with a few noted exceptions in terms of meeting or public forum or whatever? Is that something we need to discuss more? Someone need to propose that as a formal proposal?
Dr. Hurd, I believe what you need to do is make that an agenda item for next week if you want to do that. I mean, you can kick the can around all day tonight, but as far as actually deciding that you want to move forward on it, you probably need to actually make that a formal agenda item for next meeting.
Additionally, I doubt any of us, I know I haven't read commission rules, so I don't know what they are.
I have. They're lengthy. Okay, yeah, I was just wondering about the process. I mean, my understanding is we can discuss and take action on anything, even if it's not on the agenda. But I also understand that we probably, as a group and individually, like some time to digest the bigger part, the bigger process.
Yeah, and I would go along with that. I would say let's look at the rules, take our time to do that over the next few days, and have Mr. Sanders kind of maybe get those out to us. And I'd like to consider that we would do our public forum once a month or less, because if we go back to a quarterly meeting, non-pandemic, that's when we should be having this. So we would offer that whenever we meet on a less busy schedule. So I think once a week is too much for public forum. Once a month, once every 2 months, 3 months, 4 months, whatever we're meeting at that point would be then appropriate. And I would like to see if we could codify that in what's being presented.
Isn't that what the county commission, do they have a public forum once a month? Is that their frequency?
County commission meets in a workshop. They meet twice a month. They have a workshop, and then they have their actual meeting. David, I'm drawing a blank. Did they have public forum at the workshop?
Yes, they have public forum at both.
They have public forums. So they have two consecutive meetings on 2 consecutive weeks. The workshop where they discuss what they're going to talk about and set the agenda for the actual meeting. So they have public forum twice a month, I guess, ma'am.
Right.
Right. But it's the way I believe it's written is every week or every meeting, that is. So that's the way they do it. Again, we could if you want to have a set of rules and adopt your own policy, you may. But right now you're operating under county commission's rules until you vote otherwise.
If part of the concern is the amount of time that it's going to take for every single meeting, does county commission have a set, it's 30 minutes, or does it 10, 15? It could be shorter if we had to.
It has no formal limitation. I think what they typically do is they take about a certain amount of time, maybe half an hour. I'm not sure it's formally written anywhere. It may be the chair's discretion at the beginning of the meeting. And then everyone else who signed up or wishes to speak will speak to the end. And theoretically, people could be there till midnight. But at least you'll be surprised how many people decide it's not worth it to them to stick around until midnight. But you give them the opportunity to speak. You get to control when, even within the confines of meeting every week. You don't have to have it at the beginning of the meeting. You don't have to have it in the middle of the meeting, and have it whenever. But the tradition.
We could put a time limit like we did last time.
I think I am hesitant to say the county commission will say nothing about limiting to half an hour of speakers overall. I think you could say you'll take half an hour of speakers at the beginning of the meeting and allow everybody else who wants to speak at the end. But county commission rules have no limitation about how many speakers can speak, which is effectively what you're doing when you say you're limiting it to half an hour overall, because half an hour overall times 5 minutes person is 6 speakers. Now, of course, I will say that 5 minutes is also a somewhat arbitrary number. That is, you don't have to choose 5 minutes. You can choose 3 minutes, you can choose 2 minutes, you can choose 15 minutes. It's up to you. But County Commission follows 5.
And David, with commission, the chairperson does have some discretion on all of that, correct?
Yes, and also a convention that the County Commission follows is asking all people who are there in person who are speaking as a member of a group to select a spokesperson to speak. Now, I will say that I'm not so sure that that's honor more in the breach than actually having it done, but that is theoretically something you can do. Now, obviously in Zoom, that's pretty hard to figure out who's there with whom and ask them to have a spokesperson speak for everyone. But I think I will certainly agree. I can't remember who said it, maybe Dr. Gocher, but forgive me if it was somebody else, that it's true that when there's a hot button issue, that's when you get lots of speakers. On typical meetings, you're not going to get just scads of speakers. It's the hot button stuff. It's the stuff that makes people mad, but that's the way government works. You all are performing a governmental function, and people want to have their say about what you all are doing.
Mr. Sanders, I have I guess a technical question, if you could help me understand. Aside from sunshine laws, which we understand, we need to hold these meetings in public and not discuss anything unless we're in a meeting with one another. Separate from that, is the public forum, is that actually a law, or is it a rule that, let's say, the county commission has? I just want to be really clear about the difference between laws and
it's the latter.
Rule.
It's the latter as far as what county commission. No public entity in Tennessee is required to have a public forum. You don't have to have it, but
and I'm not suggesting that. I just wanted to clarify.
I understand. Yeah, but it's worth clarifying. But the county commission does have it. So long as you're under their rules, you need to have it. If you want to establish your own set of rules that do not have a public forum, you can do that. That's whether or not you do it is a policy issue again that I don't need to be in the middle of.
Thank you.
Can I ask, at one point we talked about having a location to post, items of work that we might want to work on so that we each could see what's going on without discussion. I haven't heard anything about that or seen that come up, because this would be an excellent way to start that. I don't mind the public seeing what we're working on, but to see if we might put up rules and kind of have a workspace.
So this is Martha. I just got texted, and we're not sure where we are on that right now. My staff started working on that. We can follow up with the board in an email or something about the status of where that is. I think other things happened, like county commission met virtually, unexpectedly, and stuff like that.
Yes, to follow up on the question, the public bodies such as this one, I know the county commission does do it. I know the school board has considered it. I know of no reason offhand why this body could not do it, is have a public discussion forum, electronic discussion forum, where you all would post messages and or documents and reply to them, so long as it's in the public and certain rules are followed. The rules I do not have at my fingertips right now, but I can certainly get them in short order. You could set up a forum like that. I'm not sure that that's what you meant exactly, but offhand, I do not see a problem with that.
Right, and just to clarify, it is not, the public can't post on there. Like right. I can see commission's forum, but I can't comment on it at all. I can't ask them a question. If I have a question about something they're saying on there, I have to reach out to a commissioner. So it's just for commissioners to post things and or comment.
That's what I'm hoping we could have, so this would be a great way to discuss, as it were, put out there ideas about rules and then be able to move on them once we have the meeting.
Yeah, and yes, we agree. I just want to remind everybody that this board doesn't have its own support staff. They're called my staff, or sometimes the mayor's staff, and all of whom have a lot of other things to do. Supporting this board is very important, but we're not dedicated solely to this board. That may be something we have to talk about if this board continues to meet as frequently, and that kind of the level of support continues to be high. We may need to consider budgeting for this board and somehow organizing this board differently. That would take a lot of work. We're not going to do that in the middle of a pandemic. So at this time, we will continue to support you as much as we possibly can.
And I just put a link to County Commission's forum on the chat box if y'all want to go take a look at that.
Thank you.
All right, any further discussion, or do I need to turn it back over to Dr. Gocher now that he's back online?
Thank you. Thanks everyone for your patience. I had jotted down a couple of items of other business. We've covered all the ones that I've jotted down. Is there any other business in the other business section to come before us? Comments, questions, concerns, discussion?
Dr. Gocher, I had just one, and really it's in follow-up to something we've already decided to pursue. And so we've asked for the college campus to give us a report, however frequent, just give them the invitation and the request if there's anything that they need. Ms. Wagner, I don't know if a similar thing, I mean, I understand that we are not the body making decisions for Knox County schools, but just to hear, I mean, I looked at the website today, the knoxcountyschools.org/COVID, and there's a variety of green, yellow, and red of different things. But I think from a decision-making perspective, just for a few minutes each week to have a formal sense of just where things stand, I think that would be helpful for us as we put that in context of everything else we're talking about, because that's another major thing affecting what we're doing.
We'd be happy to do that.
Thank you.
Thank you.
That's great. Thank you. I was thinking the same.
Any other points of discussion? If not, we'll accept a motion for adjournment. And a second.
I move to adjourn.
I second it.
Thank you very much.
Thanks,
and appreciate all the input from everybody. Technically a little difficult today, but not too bad. But thanks everybody for your patience.
Have a safe trip back, Dr. Gocher.
Thank you. We'll see you all probably next week, if not sooner. Thank you.